Hi, coming up next on the SPNN Forum, we have Sherry Sanchez Tibbetts, the Director of Diversity and Inclusion for the Alzheimer's Association of Minnesota and North Dakota. Hi, I'm Martin Ludden, Executive Director of the St. Paul Neighborhood Network, and we are here for the SPNN Forum in the Kwame McDonald Studios. Today, our guest is Sherry Sanchez Tibbetts, the Director of Diversity and Inclusion for the Alzheimer's Association of Minnesota and North Dakota. Sherry, welcome to the Forum.
Thank you, Martin. I'm happy to be here today.
We're glad to have you. So let's start real basic.
Sure.
What is Alzheimer's and dementia?
That's a good question. The best way to think about it is to think about dementia as an umbrella. It's a general term for memory loss or cognitive issues that interfere with daily life. And underneath the umbrella are several different types of dementia. Alzheimer's is the most common form.
Okay, thanks for that. Does does Alzheimer's or dementia, do they affect like all populations the same? Is it a pretty even distribution?
Well, unfortunately, our research has shown that some people are more impacted by Alzheimer's and dementia. We know that women, African Americans, Native Americans, Latino and Hispanics, and LGBTQ members are disproportionately impacted by Alzheimer's and dementia. Women are 2/3 of all Americans living with Alzheimer's. 2/3 of them are women. And older Black and African Americans are 2 times more likely than their white counterparts to develop Alzheimer's or dementia, and Hispanics and Latinos are 1.5 times more likely.
And I guess, I mean, that shouldn't be surprising. We know there is a great kind of, there's a gap, there's a disparity in health outcomes, especially for communities of color. Is there, what are some of the barriers there for like, or are there barriers for treatment, access, those kinds of things?
Well, yes, without a doubt, I think the facts are clear. We know that systematic inequities are a cause of the disparities that we see. And this year, the Alzheimer's Association released a facts and figures report with a special section that showed the racism and discrimination many communities of color face when they're looking for access or care.
So does that look like, you know, fewer diagnoses, less access to services? How does that go?
So, not less access to services, and we'll get into that in a moment. But we found that when women or Black, Indigenous, or communities of color they're more likely to get Alzheimer's. They're also more likely to be diagnosed at later stages and less likely to find the care and support they need. Now, the Alzheimer's Association provides services to everyone, and we've been focused on making sure that all members of our community have access to the education and resources we provide.
Now, I would imagine, though, that before like you can provide those services, there needs to be, you know, on the front end of that, what do we see? Why are those disparities there, kind of on the diagnosis side before they can come to you for services? Well,
there are many causes of dementia and Alzheimer's, and really, genetics only account for about 1% of all cases. There are other environmental factors, and we also have learned that when people are taking steps to reduce their likelihood of heart disease, diabetes, or hypertension, they're also reducing their risk of developing Alzheimer's or dementia.
So what are some of those steps that people can do to mitigate some of those risks?
Well, you know, the Alzheimer's has a class that has 10 tips for maintaining a healthy brain, but some of those are really basic lifestyle changes, like making sure that you're getting enough cardiovascular exercise, eating a healthy diet, eating a healthy diet, getting enough sleep, making social connections, and taking classes. And the rest of the tips you'll have to actually take a class to learn more about.
Not going to give it away.
Not going to give it away.
Yep, that's great. And we'll talk. By the end of the show here, we'll give some links and some resources on that. So, you know, we're coming in through, hopefully, knock on wood, towards the end of this COVID-19 pandemic. What has been the interplay there between, you know, kind of Alzheimer's and dementia and COVID-19?
COVID has had a devastating impact on people living with Alzheimer's or dementia. The CDC has reported that deaths with people who have Alzheimer's or dementia has increased by 12% in Minnesota. And that's the most of any disease reported by the CDC. But we also know that the social isolation has impacted people living with Alzheimer's or dementia. It exacerbates sort of the underlying conditions. And caregivers, especially unpaid family caregivers, are burdened with interruptions in schedule and looking for resources, centers that are closed.
Yeah. Is there, so patients that have both Alzheimer's or dementia and COVID-19, is there a unique mix of issues there, or is it kind of the same stuff that someone who doesn't have any cognitive issues are going to see?
Well, first, Alzheimer's and dementia do not cause COVID.
Right.
But some of the, just to make that clear, but some of the underlying conditions of Alzheimer's or dementia sort of make someone more likely to develop COVID. The advanced age, any underlying health issues. People with Alzheimer's or dementia are 2 times more likely to develop COVID. And it's because sometimes they are unable to follow through with basic health preventions, the preventative health care. They may live in congregate settings. And then the increased isolation just really, again, exacerbates the underlying dementia or COVID situation. Excuse me, underlying dementia or Alzheimer's situation during COVID.
Yeah, and I imagine if you are both isolated and somewhat, you have a cognitive issue, like even noticing some of those early symptoms might be a problem, and then getting treatment from there even.
Yep. Well, the good thing is, as we're getting more vaccinated and as people are going home and seeing their parents or their grandparents, it's a good time for those loved ones to sort of notice any changes in cognitive behavior and reach out to the Alzheimer's Association with any questions.
What are some of those things they might be looking for, and kind of those early flag warning signs that you might be looking for in your loved ones?
Well, we have a great campaign right now that shows it's not what you think in terms of memory loss. It's sort of like not being able to do routine tasks that you normally have done before, like how to use a remote control. It's not, I don't know where I put my keys at today.
Right. I think that's kind of, there's a misconception there. I think there was a book like, Where Did I Put My Cheese? And it's, it's not about like.
Well, I haven't read that book yet.
It's not about that, but it's more about, I can't change the channel.
I can't. I don't know how the remote works.
Yeah.
I'm not able to drive a car safely.
Yeah.
Alzheimer's really is a brain disease, and it impacts your memory, your thinking, and your behaviors.
Yeah. And there's we talk about cardiovascular health as it relates to brain health. What is that link there as well? Is it about like oxygen to the body, or how does that work?
Well, I'm not a scientist.
Right.
I have to
Nor
say
am
that. Well, that's good, especially since you're asking science questions. But really, what we see is sort of the underlying conditions related to heart health. It's the same that you see with diabetes or hypertension, that when the overall body isn't well, it affects the circulation and your brain function. And because Alzheimer's is a brain disease, it impacts everything.
Yeah, yep, that tracks. So as the Alzheimer's Association, what services do you offer in this setting?
We offer a lot of services, but I think what really we offer the most is that we offer hope to people living with Alzheimer's and their caregivers through education and resources. No one should ever have to walk this journey alone. Yeah. We also empower communities by having listening sessions and developing community partnerships so that we're better able to learn about a community's needs and create opportunities for volunteers to be engaged in all areas of our work. We work with healthcare systems to ensure that primary care physicians are more responsive by bringing awareness and making them knowledgeable about the disease. And we're the largest nonprofit private funder of Alzheimer's research. We connect people to clinical trials all across the country as we work to a world without Alzheimer's.
Yeah. What does that look like? So, I mean, and kind of, as you're talking about like pharmaceutical research, medical research, and kind of educating primary care providers. Like, how does that, especially on the treatment side, what can we do?
What can we do? the best thing that people can do is to look for a trial opportunity to participate in. You know, we know that some communities haven't always had the best relationships with scientific research, particularly African American and Native American communities. But the Alzheimer's is really intentional about ensuring that we are providing access to everyone, and today's research is tomorrow's medicine. So we need people to participate in clinical trials so that it works for everyone.
And are those primary, like, are they pharmaceutical, or are there other interventions? How are they treating?
They're a mixture of clinical trials. You can find out more on the website.
Cool. And so the services that you all provide, is there a fee for those services? Or?
There is no fee at all. Everything is free. Not only do we provide a 24/7 helpline that someone can call with any questions, any concerns, and our helpline will be answered within 60 seconds by an actual person with over 200 different languages available.
Oh, wow.
So we have our helpline. We offer one-on-one care consultations so that to help navigate the process of what an Alzheimer's or dementia diagnosis looks like. We offer care and support groups for both those who are living with the disease and their caregivers. And then we provide education and classes for everyone.
Can you say more about what some of those classes are? I know you mentioned like top 10 ways to prevent Alzheimer's or stave it off.
10 ways to love your brain is what that class is called. We have other classes that focus on the 10 understanding dementia and Alzheimer's, the 10 warning signs of Alzheimer's, and then there's even classes about how to communicate with someone who has Alzheimer's, having those difficult conversations like when to stop driving or doctor visits or legal and financial planning.
Without giving away the whole class, what are some of those, because those are difficult conversations, especially around the keys. What are some of the ways that folks can work with loved ones that they maybe think are headed down that path?
I think the first step is to call the Alzheimer's Association, set an appointment with a care consultant. You'll have a one-on-one opportunity to meet with someone who will be able to walk you through those steps, to provide the resources that you need, and to give you the communication tips you need so that you're better able to communicate with your loved one.
And so you talked about listening sessions too, and I think, especially, we're learning that, different communities have different needs and they vary significantly. So what are some of the things?
And that's why we're having our listening sessions, so that we can understand that a little bit better.
And what are you understanding out of those sessions? What do communities need for support here?
Well, we're learning that we, as an association, need to spend time and develop partnerships within community so that we're not only providing services, but we're getting them out to community in a manner that's most responsive, so that we can recruit volunteers, so that someone can take a class and have it being taught by someone who looks like them and understands cultural nuances. And then we're also developing some support groups that are community specific. This year we're launching a Spanish support group, and we'll also be launching support groups for Native Americans and LGBTQ community members. Those are sort of a result of our community forums and listening sessions.
I would imagine, that you talk about the social isolation coming out of COVID, but I think, caregiving for a loved one, especially with a cognitive reduction there can also be isolating.
It can be.
Are those support groups, is that a popular place for folks with loved ones? Like, is that a good environment for them?
It's a good environment. We've pivoted, so most of our support groups are online. As people are getting vaccinated and things are opening up, we're looking to hold more of our support groups in person again.
And are those, I imagine we could find those on the website.
They are
How does
on our
someone
website.
plug into one of those?
Our website is alz.org/MNND. You can find education groups, support groups, other resources there online.
Excellent. If you are just joining us, we're here with Sherry Sanchez Tibbetts, the Director of Diversity and Inclusion for the Alzheimer's Association of Minnesota and North Dakota, and we're hearing about some of the disparate impacts of Alzheimer's and dementia on communities of color. Sherry, thanks again for joining us.
Thank you, Mark.
And we were just talking about the website, which is www.alz.org/MNND, where folks can find support groups and resources to support loved ones who may have Alzheimer's or dementia. You also mentioned volunteers. So what do your volunteers do?
Well, our volunteers start mostly, they We use them through all areas of our work. We really think that that community connection is important. Volunteers can provide education. We will train our volunteers so that they're community educators in providing Alzheimer's and dementia information to their own community. They can be they can join us on walk and advocates at the Capitol. Really, if you want to volunteer with the Alzheimer's Association, we can find a place for you.
Can you, and you mentioned the walk, and I had forgotten about that. Your walk is a huge event.
It is one of the largest peer-to-peer events in the country, and it's really an easy opportunity for people to join the Alzheimer's Association. There's no registration fee, and all proceeds go towards research.
Excellent. You also mentioned volunteers at the Capitol. So beyond kind of service, providing these direct services, what other work does the Alzheimer's Association do?
Well, we also work with policymakers to promote awareness of Alzheimer's and dementia. And in that, we will ask some of our volunteers to share their story about what it means to be a caregiver or to be a person living with Alzheimer's. We regularly, throughout the association, invite persons with the disease, who are living with the disease, to share their story and to be part of our boards and our committees.
That's excellent, because you're also, and I imagine that's difficult work to do, but to involve and engage the people actually living with the disease in some of that work.
It makes us not only accountable, but it also makes sure that we're providing services that are responsive to those who are most in need.
Yep. What are some of those things that, and I know we're nonprofit people, we have to be careful about legislation, but what are some of the issues that you're tracking through the Minnesota legislature?
Well, right now, one of the things that is really important is providing education to first responders and law enforcement about dealing with Alzheimer's or dementia, as well as a silver alert for if someone goes missing who has Alzheimer's or dementia, that it's similar to an Amber Alert where the notice will be put out.
Yeah, and that's, I would imagine, particularly important for law enforcement when dealing with communities of color to identify,
It's important for, in Minnesota, there are about 99,000 people living with Alzheimer's or dementia.
Wow.
And every 65 seconds, someone is diagnosed with Alzheimer's or dementia. So this is it's a disease that affects many people in many different ways. And it's important for those who have first contact to know the signs and know how to work with someone in those situations.
Yeah. Have we seen, and it's not to go far into the science side again, but is awareness building of Alzheimer's and dementia, or are cases increasing, or both?
I think it's both. Okay. I think as we see an aging population, while there are many factors that are responsible for developing Alzheimer's or dementia, one of the biggest factors is age. So as we see an aging general population, we also see increases in Alzheimer's or dementia.
And the other things that kind of go with and impact as well as folks get older, I imagine.
Most definitely.
Yeah. You mentioned a crisis line, and that's 1-800-272-3900.
Yes. It's a helpline, so it's more than just a crisis. Even if you're not in crisis, or if you just have a question or need someone to talk to, I encourage everyone to reach out and use the helpline. That's what it's there for, 24/7, 200 different languages.
And the 200 different languages, I think, is amazing, because we know, and just here in Minnesota, I think they speak. There are 80 different languages in the St. Paul Public Schools, and just to be able to to respond to communities that actively is great.
I just heard from the call center last week that they have never encountered someone speaking a language that they couldn't help. So
that's fantastic.
That's what that's what the line is there for.
Yeah. I think you also have a fairly active social media presence. I think we can find you on Facebook at ALZMNND, and the same on Twitter.
Yes.
Are there other ways for people to connect with the Alzheimer's Association?
So in addition to our helpline and our website, we also have an app. It's a Science Hub app. It keeps you up to date with latest research, gives you viewpoints of the Alzheimer's Association, helps you keep current with some of the trends. And then our community ed classes are also available both on our website and through our helpline.
And are those community ed classes, are they, I think the Zoom schooler families would recognize, are they synchronous or asynchronous? Can folks check those out kind of whenever it's convenient?
Both. There's a combination of both.
Yeah.
So for maybe a group, a nonprofit, or a church community,
Yeah.
we could do one sort of on demand in a customized setting. And then there are others that are available on demand or whenever someone wants.
Yeah, and that's through the app and online?
It's
And
only
the website?
online.
Okay.
It's only online. You can also register though through our helpline. The app is really, it's our science hub app.
Yeah.
So for us non-scientists,
Right.
it's where we go for information.
Excellent. That's cool. So you raise funds for research. You don't charge for this
We don't charge
vast
anything.
array of services. How does the association work?
Well, it's really complicated. No, but we are a nonprofit, so we seek private funding, we seek federal funding. We have fundraising events throughout the year.
Excellent. So we talked about kind of some of the classes in can you give us sort of the top 5 early warning signs? I know you talked about not being able to do kind of so not being able to do your sort of general daily activities. Are there any other, like, one kind of red flag, something we should look out for?
You know, Alzheimer's and dementia vary from person to person. I think really when you have a diagnosis with your primary care physician, it's the starting point.
Yeah, that's good to know, and that's a good answer, because I think we have to, as lay people, we're not scientists.
I can't say.
We can't diagnose, but that means we have to make sure that we're keeping an eye on our loved ones and getting them into that
Exactly.
That primary care environment.
And making sure that your doctor is asking those cognitive questions. I hope that one day sort of cognitive health becomes a routine screening question. Certainly when my mom is going to her doctor, I hope they're asking about her brain health and how she's functioning.
Yeah. Do you come to this work because you see this as a national and growing issue, or is there a personal connection for you?
Well, I have a personal connection. My grandmother actually had Alzheimer's before she passed away. And like many, she wasn't diagnosed soon. Like, looking back, I can see that she actually had started developing the disease before she was actually diagnosed. And I can say without a doubt, Alzheimer's and other dementia, they're thieves that rob people of time with their loved ones.
Yeah, and that's all the cause you need, I guess,
Yeah.
to do that work. That's important. I think I know my grandparents also had some of that before they passed, and I think a lot of people probably have that story.
Yeah.
Sherry, thank you so much for your time.
Thank you.
We've been here today in the Kwame McDonald studio at SPNN for the forum with Sherry Sanchez Tibbetts, the Director of Diversity and Inclusion for the Alzheimer's Association of Minnesota and North Dakota. You can find more information on the web at www.alz.org/MNND, or find them on Facebook or Twitter at ALZMNND. Thanks for joining us, and we hope to see you again soon.